But first and foremost, let's go ahead and get started. So Lisa, Doctor, you're up first. I'll let you go ahead and I think you can share your screen.
Awesome. All right. Well, thank you so much for having me today. So I'm Lisa Doktor. I'm the Senior Vice President of Special Projects for Easter Seals, Colorado. So I get to pick up random jobs at Easter Seals that nobody has the time or the capacity to do, and I get to do them. So that's what Special Projects is. And it just so happened that our Colorado Respite Coalition, our Respite Care project, landed in my lap last August, so it's almost been a year, and it's been a really great year because I've learned a lot about respite. I always had this kind of overarching understanding of it, but now I'm in it. I'm super in it and really enjoying it. So I'm excited to share some resources with you today and tell you a little bit more about what we do, because I definitely see a lot of crossover during everybody's introductions where I think, wow, well, we could totally partner with them, Amanda especially. So all right, so our Colorado Respite Coalition program, it's a program of Easter Seals. It's funded through the state and also the feds. We provide support to family caregivers, and we serve all ages and care needs across the state. So we have a number of different supports available. We have trainings, we have videos on our website, we have an online resource directory. We published a respite navigation guide if you're trying to figure out the difference between one waiver and another waiver or funding. I mean, it spells it all out. So it's a really, really great guide if you're not too familiar and you want to learn more about just kind of the general information. And then you can look us up at coloradorespitecoalition.org, or you can go to eastersealscolorado.org, and it'll direct you that way also. So who we support, like I said, we support family caregivers. Let me just close this. Caring for people of all ages and care needs. We have all of our materials in English and Spanish. We're also able to get interpreters if you need that. And that's pretty much the gist for that side. What is caregiving? So care can be provided to individuals of any age, and it can include help with medical care, personal care, finance management, household maintenance, transportation. And we see a lot of this with our sandwich generation, right? People who are raising children and caring for other family members, which is, I think, a lot of us on this call. There's a lot of challenges with caregiving, right? I think the number one thing that we see is that people don't self-identify as caregivers. They see themselves as, well, I'm just taking care of my spouse because I love my spouse. Or I'm taking care of my aging dad because he's my dad and I love him. It's not a job. So it's hard to, people have a hard time self-identifying, but fact is you're a caregiver, and when you become a caregiver, there's a lot of changing of family dynamics and your roles, and then burnout can definitely happen after time, and it can last. Being a caregiver can last several years and sometimes even a lifetime. And finding support, we see this all the time, is difficult and it's expensive. And self-care for yourself falls to the wayside, and there really is just this kind of lack of awareness about resources, and that's kind of where the coalition comes in. We have trainings on self-care, stress busting, which I took the training and it was phenomenal, and also it's a whole place of where you can collect resources and you can read about what's available to you. We also, actually, I'm going to go back and tell you a little bit more. We actually have a voucher program as well, where we have state funds, or not state funds, excuse me, federal funds. And I believe we have about $30,000 at this point. Would you say 30?
Yeah, it was
$36,000 that we can give away if you need help. So we do it, and I think right now we're at $1,000 a voucher. Is it 1,000? Oh, it's 500, but we might up that to 1,000. And basically, you just go through the process. It's a very quick and easy application, and then you can choose a provider from one of our 40 approved provider lists, and then we'll give you that money and you can go ahead and use it at one of those approved vendor sites. So that leads me actually to one more thing, which is if you are a site that's providing respite of any sort, or you know people who are providing respite, they can go ahead and apply to be a part of our preferred vendor list. And that's, again, a very easy process, but I think would be a really great chance for you all to get out there and publicize your various programs. But like I said, the voucher program is pretty successful. And in years past, we had waiting lists, and then COVID hit. And obviously we were quarantining and nobody was really using the vouchers, hence why we have quite a bit of money to spend down by August. So reach out and we will try and get you set up with that. Going back to compassion fatigue and burnout, compassion fatigue and burnout are two separate things. So compassion, a combination of physical, emotional, and spiritual exhaustion associated with caring for others. You see this in human services, emergency response, childcare, healthcare. And burnout is a state of emotional and physical exhaustion caused by excessive and prolonged stress. And so this is likely to occur with our caregivers, right? When they're taking care of somebody 24/7, 7 days a week, that weighs on you over time. You want to keep a lookout for signs of burnout among caregivers. There's changes in social interaction, withdrawal, your immune system is weakened, your eating habits, your sleeping habits, your emotional wellness, you're exhausted, and sometimes you're just kind of irritable and angry, or you're feeling low or blue, or just having a hard time being motivated. It occurs. How does burnout occur? It's a process, and it doesn't occur overnight. It takes time, like we talked about. But if it's addressed, and you start utilizing some of the tools we have available, then it won't be so burdensome, if that makes sense. So it's important because chronic stress can lead to burnout. And really, family caregivers are at a higher risk for heart disease, hypertension, obesity, and stroke. So we often see, at least in the coalition here, that many of the caregivers end up more sick or in a worse place than the person they're caring for. So it's really important, that self-care piece, to make sure that you're taking care of yourself. Rates of depression are higher. And I like this little analogy, when you're flying on a plane, they tell you, make sure you put your oxygen mask first on yourself and then assist the person next to you or the child next to you. So you really got to take care of yourself first before you can take care of others. And it does take a village. I mean, I feel like I hear that all day, every day with my two littles. So your care may be super, but you're only human. So this is a campaign that we ran, I think like 2 years ago, and you might have seen it on TV and on the radio, but it's really to help people self-identify. So some of the people that you might work with in your programs, helping them to see that they are a caregiver, and then sending them to the Colorado caregiving.org website or Easter Seals website, so they can learn about respite opportunities and stress busting and like that emotional health and that self-care piece. So, different resources for respite. You can have in-home or community center. You can have people, family and friends, volunteers or professionals come in and help. There's really no set time limit. And what else? And like I said, you can find providers. So this is a neat thing too, also on our website, the Colorado Respite Coalition.org. You can go there, and like I said, you can either apply to be a part of the preferred vendor list, or you can just put your information on there. So we have about, I think there's 500, 600 various providers on there that provide respite. So day programs, senior centers, in-home care, it's all on there. So you can go ahead and just fill out the information, your hours of operation, all that good stuff. And it's a good place for people to just locate you. And we get an email notifying us that, you've applied or you've put your information in, and then we just approve it. So, and again, if you want to check out that respite navigation guide, it's really, really well done. it was before my time, so I'm not giving myself props there. All right, so support groups, the caregiving training. We do have the stress busting program I told you about that I did the training for. So we are happy to come to any facility and or even do it virtually and share the stress busting program. It's a couple hours and has workbooks. It's just very, very good and comprehensive. And I think you would, or your programs would, and your staff and caregivers would get a lot out of it. We're working really hard to engage the faith community. We see that a lot of our churches and other faith-based groups are really tied in and clued into the community. So helping, engaging with them is a good place for caregivers to go to. And then really just having conversations with your caregivers, what's working, what's not, looking for those signs of burnout, and then making sure that they know that there are resources available and that the AAAs can help. That's the Area Agencies on Aging. And there is money out there to help support them. These are just different stress management strategies. A lot of this we talk about in the stress busting training, which, like I said, we're happy to do for you. And we're really here to support you and support caregivers and really just get the message of respite out there. And actually, my last week with Easter Seals is Friday. So if you have any questions or you want to schedule a stress busting or you want to just learn more about the voucher program, you can contact Megan Bettinger. She's my colleague. She's actually sitting right next to me, and she's our manager, and she will get you set up and taken care of. And I've been with Easter Seals for almost 20 years, and I love Easter Seals, and I love what we're doing with respite. And so my leaving Easter Seals is not because of Easter Seals. I just got a really great family business opportunity, so I'll be moving back to California. So I just wanted to give that little plug. Easter Seals is great. So you can check us out. And I guess that's about it. I talked fast.
Okay.
But, I did just think of something that I do want to share. So our program is funded by the state and the feds. So we have two parts. Our state funding, we actually award grants up to $35,000 to agencies that provide some sort of respite. So if any of your groups, Amanda, I feel like you are like right up our alley, you could apply. The awards are typically given out in September, but the application goes out in August, and you can request up to $35,000 for your business to provide respite to offset your costs. So I would encourage anybody who's doing that kind of work to check that out or get on our mailing list so that you get information come August about that. That's it.
That's
awesome. Thank you
for the info.
Yeah.
I am a huge, I just say I'm a huge fan of your program. We've actually used the voucher program for caring for my in-laws, and anytime I'm talking to a community, I ask if they provide respite. I have a couple very specific family questions. Always talk to them about this program, and I have sent out this link more often than not to a lot of communities because I think
I love that.
So I think it's fantastic. So kudos to you.
Oh, thank you so much. I'm so happy to hear that, and that it's been an easy and good process for you. That was the kind of the goal, is to make sure it was easy for families. So good.
Thanks, Lisa. Any other questions or comments? Anything for Lisa? I had a question, Lisa. How long, if someone receives a voucher, is there an amount of time that they need to use it?
Yep, they have 3 months to use it. And if they aren't able to use it, then you can just let us know and we can, extend it. But we typically like people to use it within 3 months, because if you're not going to use it, then we're able to allocate that money to another family that needs it. So that's kind of why we have that time frame.
Gotcha.
Lisa, this is Jeannie Davis. I was wanting to ask a question regarding your stress management workshops.
Sure.
Are those presented right now virtually?
Yes, ma'am.
And are they presented for a wide array of audiences? Do people sign up to participate, or could, for example, the Aurora commission for older adults ask you to come and to do a virtual workshop for them?
Yep. So you would just let Megan know that you want to do a virtual workshop, and we would set it all up, and we would send the materials in advance to you.
Mhm.
And I don't know how long, if it's like a half day. Is it a half day? I don't recall how long, but it is I was very impressed by it when I took it. Yeah, it is intensive and comprehensive, but it's very good.
Okay, thank you.
Yep.
Awesome. Thank you so much.
Yeah, and I apologize that I have to jump off and get on another call. So please forgive me, but wishing you all the best, and thank you for this opportunity.
Thanks, Lisa. I appreciate it.
Sure. Bye-bye.
And I didn't mention at the beginning, but we typically will send out the slide deck from our presenters in our follow-up email. So if you didn't catch, if you wanted to see the information again, we'll have that for you. So, okay. All right, Colette, you are up next.
Okay, excellent. All right. So my name is Colette, and I am the patient advocate at CU School of Dental Medicine. And we are the lucky recipients of one of our state's finest programs, the Colorado Dental Healthcare Program for Low-Income Seniors. It is a mouthful. That's why we call it Senior Smiles at the school. This is a program that is state funded, and it's a grant designed to provide dental care for qualifying seniors in Colorado. The guidelines for eligibility and participation are established by the state of Colorado, not us. Who qualifies for this program? So currently for us, it's patients who are currently participating in our program in one of the clinics, or someone who's accepted through the school via a screening process. Once you become a patient, if you want to qualify for the program, you must be age 60 or older. You do not qualify for Medicaid, so you are over 133% of the poverty level. You do not have private dental insurance, and we will talk a little bit more about that in the next few slides. Your income has to be at or below the 250% of the most current federal poverty guidelines based on family size. You have to be lawfully present in the US and a Colorado resident. This program is amazing, and it sounds too good to be true because it really is. The procedures that are covered by this funding cover probably 95% of the things that we do at the school dentally, all the way from x-rays, cleanings, fillings, extractions, dentures, crowns, root canals, exams, and more. And so what happens is the state gives us a chunk of money on July 1st, which is the beginning of the fiscal year for the state. They give us this money and it needs to last us all year. What we do is we bill at the end of each month what we've actually done for patients, what we've completed, and we submit it to them, and then they reimburse us. What is not covered by this program? Things like fixed bridges and dental implants, things that people really, really want, but we just can't provide those at this point. There are some periodontal surgeries that aren't covered, and bite or night guards. This is not an exhaustive list, but it's really kind of one-off things that people don't really usually ask for or need. So how does the program work? So what I do is I do let everyone in the school know, faculty and staff and students and residents, about this program, so that when they encounter a patient who has a treatment plan that they just cannot financially handle, they'll contact me, and then I'll talk with the patient. I will get them on the phone, or if I see them personally, I will ask them the questions that you see in front of you. I need to know, again, are they legally in the US, resident of Colorado? I ask if they're a veteran because we actually have a veterans program here called the Heroes Program, which is separate, but it's also another avenue to help seniors get their dental care paid for. We ask about if they are qualified for Medicaid. Traditionally, most seniors do not qualify for Medicaid, especially if you're over 65. But what Medicaid can do is help to contribute to a senior's Medicare costs. So even if they're not going to get dental care through Medicaid, they could get other assistance as well. So we do ask about that. And there is a site that I can go to check if they already have something like that, or if they should be actually applying for some Medicaid assistance. I will ask if they have dental insurance. This is where it gets a little bit tricky. Most seniors, either if they don't have Medicaid, they may have their own private insurance that they're paying extra per month for through Medicare. But we've developed these new plans through Medicare over the last year or two, and mostly this year, where Medicare is adding on a very small dental benefit for their seniors. It's included in their coverage. They haven't paid extra for it, they haven't asked for it, and they can't opt out of it. But it gives them a couple exams, couple cleanings, couple x-rays a year, and it really doesn't cover any treatment. So it can get them to the point where a dentist will say, here's what you need, but it doesn't help them actually achieve that. So this was a question that really we had an issue with at the beginning of the year. The people who run the program through the state contacted all the recipients around the state and said, look, you need to be looking at all of your senior patients. If some of them are on these new senior advantage plans, you're going to have them pay for their dental care. They have dental coverage. So that's part of the eligibility requirement that you don't have it. So everybody was scrambling because we had patients in the middle of their treatment who thought they were going to be covered. And frankly, when I called all 200 of my patients on this program, I would say 90% of them didn't even realize that they had one of these senior advantage plans that had a tiny dental benefit. So it was a learning experience for all of us. And then about a month and a half into this year, the folks who run the program contacted us again and said, you know what, we understand that people who are on these senior advantage programs didn't really sign up for them, and they can't get rid of them so that they can keep their really great senior smile benefits. We're going to allow you to keep them on there, but we want you to submit to Medicare. Well, we don't have the capability to do that. So long story short, we're keeping our patients on this program at this time because the state was not prepared to do anything with the Medicare portion of this. And I know it probably doesn't make any sense to you because it took me a long time to make sense out of it, actually. But the good news is these folks really still do have coverage through our Senior Smiles. So there are some people who do have their own private Medicare, but for the most part, people who come to the dental school can't afford that. That's why they're at the school. So they are in that middle income bracket that they don't qualify for Medicaid and they don't have enough money to actually buy their own private coverage through Medicare. So these are the folks that we're really helping out on this program. So then I will ask if they're single, they're married, and then I will ask what their monthly gross income is. So that's before they take out for any taxes or Medicare payments or anything like that. So I'm looking for any pensions, I'm looking for Social Security, any gifts that they get, any rent money, any income that they're making per month. And the zone I'm looking for is that middle box in both of those single and married categories. I want them to be, above the 133% poverty rate, but below 250%. So that's what I'm looking for. And then we already talked about the problem with the Medicare plans. So hopefully we will continue to be able to serve these folks. Next question is, how can you become a patient at the School of Dental Medicine? Because that is one of the requirements that we do have, that you are a patient, so that we can set up an account for you and submit the treatment that you get for reimbursement. We do not, by the way, ask the patient for any payments up front once we establish that they are eligible for this, we actually put the code on their chart. This sort of like an insurance, I guess, so that any cashier understands not to ask them for money unless it's not a covered procedure. So back to becoming a patient. We have free screenings at the school. All you need to do is call the number below to schedule a free screening appointment. Sometimes it takes a month or two to get that appointment, but what you'll do is it'll be probably a 3-hour appointment, maybe less than that, could be an hour and a half. Just understand that it's students and faculty overseeing them that are screening you. So it takes a little bit longer because they're extremely thorough. What we're looking for is someone that is in good enough health so that we're not going to put anyone in jeopardy by having them sit in a chair for 3 hours at a time, being in a student clinic, and having dental work done at the school. We're also looking for someone who doesn't have so many dental concerns that it would never be possible for a student to be able to finish the treatment that needed to be done. Those are extremely complicated and comprehensive cases that we would, refer out to someone else. But for the most part, patients do get accepted if they don't have health or dental issues that we can't handle. We do have 3 different clinics at the school. If you're not familiar with the school, we have a student clinic, which is the least expensive. Then we have a resident clinic. So they're typically a dentist who's been out of school for at least a year, if not more. So we have general residences, and we have a graduate periodontal residence. They take care of the implants typically. And then the last group category is the most expensive. That's our faculty practice. That's like going to a private practice. So at that point, most people only come there if they know about us. Otherwise, they're seeing another place that's maybe less expensive. So that is how that works. Which dental providers in Colorado receive this funding? There is this link will give you the list of all recipients around the state by county who actually receive this funding through the state. So there are other places to go besides the School of Dental Medicine, and they are scattered all over the state, as I said. It's such a great program, and sometimes we do refer patients within each other, their systems, so that we can help someone who might be closer than coming to us or whatever. But that is that. If you want to learn more about Senior Smiles at the School of Dental Medicine, please feel free to give me a call or send me an email, and I'm always happy to share information about this amazing program. I'm hoping that you'll have some questions for me, and I'd be happy to answer those. Let me stop sharing my screen. Anybody have any questions about the program?
Well, there is go ahead. There's a question in the chat from Barbara saying, do you have referring partners for those that you cannot assist?
There are, sometimes we do give referrals. It kind of depends on the situation, I guess. But yes, we can give recommendations, and sometimes we can give referrals. I do want to say too that so the program, we're going to get actually $200,000 this July for the whole year, which is amazing. We've been adding more and more people onto this program. There is no limit to what I will help a person pay for. So I'm not saying you can only have $1,000 worth of treatment. If someone needs $4,000 worth of treatment and they get it done before the money runs out at the end of the year, I'm happy to spend that on them. We don't kick people off the program from year to year. What I typically do is just re-enroll them. Once a year, we're supposed to check to make sure that the senior is still eligible. Most seniors' situations don't change from year to year unless they win the lottery or something. But so that is great. We have many long haulers who come and see us for their periodontal needs, and they just seem to always have something that's still bothering them. We really welcome people who need dentures, because that is something that our students struggle to get enough cases for to graduate. So if you know anyone who needs dentures, we would love to see them. But for anything else, any other senior for whatever other dental care they may need. We're hoping to get a social worker on our staff, or at least an intern this coming fall, which we've never had before, but I'm very excited about, because just talking to all of you shows me what need there is to network and get all those resources available for our patients. Even though we're a dental school, they need so many other things, as you all know. So that hopefully explains a little bit about the program. Is there anything else, any other questions you can think of to ask me? Okay, I'm happy to share my slides. And again, please call me if you have any questions for yourself or for anyone else you know that is curious about the program. The Colorado Gerontological Society is also a really good resource for senior needs. And you guys probably already know that, I'm sure, being well connected in that network. So, okay.
Thanks, Colette. Thank you so much for that information. Yeah,
Very
it's a
well.
another great resource to know, especially when it comes to, you know, dental, vision, hearing, those resources. The more we have in the community, the better. So thanks for sharing that.
You're very welcome.
Any other questions, comments? All right. Well, thanks, everyone. So I wanted to just kind of open the floor up to you all. If you have, you want to take a moment to tell us more about what you do, about your program, something that is going on in your world, an event coming up. So I know there's some announcements to be made, so I'll open up to you.
This is Jeannie Davis again. I have a huge announcement to make about the the Aurora Commission for Seniors. We are no longer the Aurora Commission for Seniors. September of last year, we requested through City Council to change our name to Aurora Commission for Older Adults. And I am excited to let you know that about 2 weeks ago, the last reading of that was passed, and effective, I believe, June 26th, we will be the Aurora Commission for Older Adults. So that's exciting. We're really excited about that. The other thing that I wanted to share is we requested support from City Council to pass a piece of legislation related to seniors. And I didn't know I was going to be able to make announcements, so I want to make sure I get this in front of me. It was a Senate bill, and the City Council supported it, and it passed, and it had to do, oh, Jeannie, it had to do with seniors and how many calls they can get to the police. You know, we've got a special victims unit here in Aurora, and I'm hoping that all of you are aware of that. The APD has that, Aurora Police Department has that. Their officer is, the leader of that program is housed over at the Aurora Center for Active Adults. And they go on a lot of calls that result in not good reports. And most of the time they get there and the senior has dementia, or there's no caregiver there, or there's a person there who doesn't have relevant information about the senior. And they get ticketed for that. They get written up for that. And so they're going to start a pilot program with 15 participating counties throughout the state. And we are very much hoping that Arapahoe County becomes one of those pilot programs, because that's very, very exciting. The other thing that I wanted to share with you is that we've worked really hard because of the COVID pandemic and the social distancing and so forth. We haven't been able to have speakers monthly at our regular meetings. And so we've got our calendar full through the end of the year. We meet the first Monday of every month. Right now it's virtually, but please do join us. We meet the first Monday of every month. And if anybody has an interest in getting an invitation to our meeting, just let me know. Thank you.
Thanks, Jeannie. Can you say a little bit more about the pilot program? What is the pilot program going to be? Is it limiting?
Just a capsulized summary of what the bill is about, if you'd like for me to share that with the group.
Sure, that'd be great. And thanks, Jeremy, for that update. Appreciate it.
That's
Yeah,
very
go ahead, Jeannie.
interesting, Jeremy. Okay, so it was Senate Bill 21-118. The bill is a program regarding protective services for at-risk adults. Presently, the law requires unannounced police visits for all reported incidents to APS, including low-risk non-criminal incidents. The police are then required to issue a finding of fault, and that's in quotation marks, which is impossible with low-risk cases. And that, again, that lends itself to the dementia and so forth. Senate Bill 21-118 proposes that for low-risk incident reports, APS, after an initial assessment, would follow up on the report. Police would not be required to respond, and no finding of fault would be required. So that is the bill that has passed, and we're very thankful for that. So
Great.
that's exciting. Mhm.
Yeah. Awesome. Thanks for sharing that. And we'll find kind of the link for that
Okay.
information, and we can still include that in our follow-up email along with the
Good.
slide decks. Yeah. Any other announcements that anyone would like to make?
I would. Gloria Vasquez with Food Bank of the Rockies. And I just wanted to talk a little bit about our senior program. It's called Commodity Supplemental Food Program, which we also have coined it Evergreen Boxes. And these are shelf-stable pantry products such as cereals, rice, canned vegetables, items that are definitely available on a monthly basis, and they are free of charge. We serve those that are 130% of the poverty level and below. And we are seeing a decrease in the numbers of older adults that we're serving. So it's those that are 60 and above. And we're trying to figure out what the issue is exactly, because the need is absolutely in the Denver community and all around Colorado. And we want to be able to serve the older adults that are in need of this additional nutrition. So if I would love at some point to maybe have a little bit of information from those on the call on maybe why older adults are not as interested in this type of option, but just something for the future, Joe, if that would be possible. But I would love to connect with anyone that's interested in us providing this additional nutrition to older adults. And I drop my email address in the chat as well. Thank you so much.
Great. Thanks, Gloria. And are you finding, it's interesting to me that sounds like your numbers are not as high as you'd like them to be as far as being able to deliver those. And then also hearing that Meals on Wheels is still trying to get more folks signed up. Is it something that you think is more pandemic based, or was it just kind of in general? There were just a hard to reach populations of people that weren't, not getting the boxes.
That's a great question, Joe. We have actually found that with the pandemic, we saw a decrease in our numbers, but because of that, we implemented and ramped up our home delivery program. So anyone that lives in Jefferson, Arapahoe, Denver, I can't quite remember the fourth one, and Adams County, we are able to assist them with our home delivery program. So we did see a tremendous increase. We're serving almost 1,000 clients via our home delivery program. But we also have pickup locations all around Colorado. And we are seeing a decrease with the pickups. And while we did see a ramp up with our home delivery, we are still seeing a decrease in our numbers. So there is absolutely a need, in our belief, in Colorado, that the need for additional nutrition, and that's something that we have been seeing the decrease in the numbers for about the last 2 years. So I joined the Food Bank of the Rockies about 4 months ago, and I'm interested in kind of figuring out what the issues are, maybe with the program or our marketing, but we want to make sure that we're serving the community.
I work for Brookdale, and we offer CE events and programs every single month. And so those are completely free. those who are in the medical field and like the continued education courses. We provide them every single month, and they're very interesting topics, all geared, of course, towards the senior population. And this month, it's an interesting one with engaging LGBT identified family members, caregivers, and community partners to really just kind of see kind of where we're at with the times these days and how to be more of a support for everyone, as well as our Denver Metro District. We're doing like a happy hour and headshots little gathering towards the end of the month, the 24th this month. And so I know some people have really changed roles, or they need new updated professional photos, and we'd be happy to provide them, get together, meet, and I can drop the tabs or the links for that in the chat box if anyone would want to register or just find out more information.
Well, thanks everyone for joining. We really appreciate your time. Thanks for being here. We are going to stay virtual. We know that there's still concerns for people who just not quite at that point of wanting to meet in person yet. And so we want to respect that. And we have 2 more senior circle meetings this year, one in September and one in November. I believe September 9th is our next one. So we'll be sending out details on that soon. Otherwise, please all stay well and safe and enjoy the summer. And we look forward to seeing you next time.
Thank you.
Thanks, everyone.
Thank you.
Thank you very much.